Hi, I'm Christina Applegate.
And I'm Jamie-Lynn Sigler.
And this is
Messy. Hello, everybody. Welcome to Messy. This is Jamie.
And Christina.
Yes.
Why did I say it like that, Jamie? That was really weird.
That's who you are today, Christina.
I guess Christina.
We have such a wonderful guest today who I just told not only are Christina and I excited to talk to about everything for our own individual needs and purposes, but I think it's going to represent all of you that are listening. Because today we have Dr. Will Cole, who's a functional medicine expert, New York Times bestselling author of multiple books. I've been a fan of his. I told him I think I'm an OG fan, like from the beginning, because he's just been ahead of the curve when it comes to gut health and inflammation and hormone balance. Been talking about this way before it's been trendy as of late. And he just helps us understand the things that make or break how we feel every day and gives attainable tools and information that can empower you to feel like you have the opportunity to live your best life. So please welcome to Messy, Dr. Will Cole.
Hi, guys. Thanks for having me. I appreciate it.
We appreciate it so much. So thank you for being here. Before we begin with our specific questions, do you mind just telling us and our audience a little bit about how you got into the work that you're in?
Yeah. So I grew up, my dad was a bodybuilder in the 80s and 90s. I thought it was normal to have your dad like lubed up with baby oil and a turquoise Speedo so that
it's
world
different
of,
over here in West Hollywood.
It's still a thing in West Hollywood.
Yeah,
but
right. That's what I'm saying.
This is like in the country in Western Pennsylvania. It was not a thing. But
wow.
So we would drink the raw milk at the local farm and just we're crunchy, I guess you could say, before the wellness world became what it was. So I ate differently than I did than everybody else. Like all my friends at school ate differently, and I knew really early on there was this thing called wellness and then this fitness world and all of that stuff. So that was very formative for me to sort of understand, and I was like educated on this stuff pretty early on. And then I really just became passionate about human health and human sciences, health sciences, and wanting to be trained in this formally. So I went to an integrative medicine school, graduated, and I didn't even have the language of telehealth. It wasn't a thing. I just moved back from Los Angeles, where I went to school, back to Western Pennsylvania. And I was where a lot of other people weren't. So we figured out all the logistics of shipping labs out, and we called it a virtual functional medicine practice. This is in 2010.
Wow.
And a long time ago. And we started the first functional medicine telehealth center, not because we thought telehealth was going to be a thing, but because I just had to figure out, because I was early on, as you mentioned, Jamie, that very kindly, I was very early on writing on like Mind Body Green and goop.com about these different topics that people wanted access to. So I had to figure out, okay, how do I get this microbiome test or this hormonal test out to somebody in Nebraska and work out all the loopholes? We didn't plan, obviously, on the pandemic, but we kind of already had been doing it for many years. So that's been my work. That's how I got here. And I just love people, and I want people to thrive and live the life that God created them for. And that's like, what's their body capable of? Is it improving their health 50% or 100%? Like what? The body's amazingly resilient when you give it the chance to do so. So I just love the art and science of wellness and human health and improving people's lives.
Well, thank God for you, especially for people like us that, can feel lost and overwhelmed, especially when you receive a diagnosis of, a chronic disease and you don't know where to begin. So for me, I was diagnosed when I was 20 years old. So that was 24 years ago, almost 25 years ago. And there was no information. It was just basically like, you have MS. We don't know how it's going to present itself. Take these meds once a week. Maybe take vitamin D, B12, and you're on your way. There was no talk of inflammation. There was no talk of root cause. There was no talk of like any other way to sort of approach this. Thankfully, as of late, that is much of the conversation. And it feels like not only with MS, but all autoimmune conditions and just in general, everybody's talking about inflammation. Can you just actually talk about what inflammation is, what is happening in the body, because I'm sure you feel this way, or tell me if I'm wrong. I think when you empower somebody sometimes with the information, even if it's in layman's term of what's actually happening, you can almost have a better relationship with your body and for healing.
Totally. Right. This isn't about putting fear into somebody or being, looking for problems where there aren't any. People already know something's off here.
Mm-hmm.
And if anything, there's so much, as you mentioned, kind of unintentional medical gaslighting. For the most part, it's unintentional. But even though we've come far in the past 15 so years I've been in the space professionally, but we still have a long way to go. And there's still so much systemic medical gaslighting. Oh, you're fine. Just take this medication. See you later. But they're doing all the things their doctor's telling them to do, but they're still not where they need to be. And this is their lot in life? And most of the time the answer is no. There's so much you can do. But so inflammation, you're right. It's this common thread. It's this commonality between just about every health problem under the sun, whether it be autoimmune conditions and all of those different iterations of, we have labels for, to metabolic problems, hormonal problems, even mental health issues. There's a whole field of research called the cytokine model of cognitive function. Cytokines are just pro-inflammatory cells. So it's researchers looking at how does inflammation impact mental health? How does inflammation impact how the brain works? And in the West, we like to separate mental health from physical health, but it's one and the same. Mental health is physical health. Our nervous systems are part of our body just as much as anything else is. Anybody with MS will tell you that. So we have to look at neuroinflammation not as it just relates to MS and neuroinflammatory autoimmune issues, but this larger spectrum of neuroinflammation that many people experience in different iterations and different facets, like anxiety, depression, brain fog, and fatigue. So inflammation is the commonality, but it's not inherently bad. But the body needs inflammation, right? It fights off viruses. It heals wounds. It's a normal defense system of the human body. So the commonality is chronic inflammation, but what causes or dysregulates the inflammatory response is actually the bigger part of my job. Because yes, measuring inflammation is important. We have to look at it. We have to calm it. But part of calming it is understanding what's dysregulating it in the first place. So it's really looking at what are researchers looking at? Why? What are the physiological factors? And I'm sure we'll get into it. And then what are even the mental, emotional, even spiritual factors that dysregulate this neuroimmunoendocrine axis, this intersection between the nervous system, the immune system, i.e. inflammation, and the endocrine system. So as you can tell, I get passionate about it because it's so fascinating, but it also breaks my heart because so many people go through it. This is not just ideas. These are people's lives, and I'm quite aware of that.
I was going to say I've been very vocal about, I've been hospitalized many times over the last 4 years because of some gut issues, stomach issues, but we'll get into that in a minute because I have a lot of questions about that. But I remember being in the hospital and the nurse was telling me that, this part of your body has so much to do with what happens up here in your emotional state. And I can't remember the name of it. I wish,
the gut-brain barrier? Or?
It's got like it's got a fancy word. I don't know. We're going to have to Google it, but it's like Cuckoo Town.
Yeah, the gut and brain are formed from the same fetal tissue. So when babies are growing in their mom's womb, they're formed from that same tissue, and it's inextricably linked for the rest of our life. As Jamie said, the gut-brain axis, it's connected to the vagus nerve, which maybe they mentioned that. Yeah. But it's responsible for that resting, digesting aspect. If you think about it, the intestines kind of even resemble the brain. The intestines even resemble the brain. 95% of serotonin, our happy neurotransmitter, is made and stored in the gut. 50% of dopamine, our pleasure neurotransmitter, is made and stored in the gut. So there's a lot of, this sort of understanding the second brain, the gut, and as how is it influencing the first brain, the brain.
Yeah. So in a way, I feel like you've always known, and I think I'm always honestly needing to have a constant reminder that symptoms are your body kind of speaking to you, right? That something is off, as opposed to the body broken, maybe reframing that there's a bigger capacity for healing and a way to live and feel differently, but the body is sending signals that something is off in the system.
Exactly. It's a proverbial check engine light. It's a nudge that your body's giving you. And sometimes those nudges are very, very strong nudges. But I guess the goal would be, if you have that grace period, to pay attention to the nudges that your body's giving you before it becomes the screams of symptoms. And if it's the screams of symptoms, then we pay attention then. Better late than never. But no matter where you're at on this inflammation spectrum, from mild symptoms to severe nudges, they are just signals, like you said. And there can be a lot of stigma and fear around these topics. I understand that. But I think reframing it's important, is that your body is trying to protect you and is trying to hold you and has done so your whole life. There's just things that your body needs some attention in certain areas, and these symptoms can be clues.
Yeah. When you're talking about like, people are talking so much about stress, right? And the role that stress plays in our overall health, acute health, everything. And I've heard you talk about how stress and shame can actually cause, gut inflammation. And and Christina as well are really trying to uncover a lot of the emotional aspects to our disease as well. Like, we both have been through a process of writing our memoirs, and like, I can look back at my life and see the amount of emotions that I have stuffed down and packed in, and anger that I've just constantly directed inward, and any kind of emotion was always put inward. It almost is like no wonder I have this. Like, what my body was almost screaming, like, I can't hold this all anymore. As somebody who is, bolstered with actual factual science information, is this true? Do you believe that these types of things are both contributing to our physical health?
Yeah, absolutely. I mean, we have to look at both the physiological and the psychological, the physical and the mental, emotional, spiritual, to understand autoimmunity. I would say to understand human health as a whole, but certainly most of our telehealth patients are on this autoimmune inflammation spectrum. So physiological things like mold toxins or bacteria toxins or viral issues or underlying gut problems, as we talked about, those are things that you can't out-meditate or breath work or trauma work your way out of an environmental toxin like an herbicide or pesticide or a microplastic, right, or a forever chemical. So you have to deal with the physical side. You have to address it. And those are things that you can quantify directly on a lab and address it. And those are drivers of inflammation. Those are things that are irritating the body on a physical level that's raising inflammation and triggering that autoimmune response, triggering that molecular mimicry, that case of mistaken identity when the immune system attacks certain parts of the body. And there's even debate about that. Is that really an immune system that's lost recognition, or is the immune system seeing these environmental toxins or pathogens and trying to protect you in that autoimmune response? But so too, the mental emotional side. And I'd call it shameflammation, or things like shame and things that cause shame, like chronic stress and unresolved trauma. How is that stored in the body? And how do you metabolize things like stored trauma, just like you would an environmental toxin or a mold toxin? But both and, not either or. That has to be the approach for anybody to optimize their health, specifically autoimmunity. And there's so much research to show. I have every telehealth patient fill out what's called an ACE score or ACE questionnaire, adverse childhood experiences. So it's looking at really heavy things like sexual abuse growing up, physical abuse growing up, neglect growing up, substance abuse. It's really heavy stuff. The research is clear. The higher somebody's ACE score, the more likely to have autoimmune issues, metabolic problems, hormonal problems, fertility issues, and of course, mental health issues. So, but it's beyond childhood. Then there's limitations to the ACE score. Then I'm talking to patients about what went on in your 20s and 30s and your relationships and your jobs and life itself. These are things that you can't undo the past, but when you, as you mentioned, when you know what you're up against, you can do something about it, because these are all things you can address head on and improve and reverse and start moving the needle in the positive direction. But you have to face it. You have to look at it. And sometimes people aren't ready to look at it, and that's okay. You have to plant seeds. But when they're ready to cross that bridge of addressing it, because then when they meet me, they think they're just going to talk about gut health and food and herbs. But then when I'm talking about childhood trauma, like, why? Like, no, this is not a problem for me. It's in the past. And they sort of gaslight themselves. But when they're ready, then we can address it and really address this nervous system work that's so important.
I wanted to ask too, just to speak upon before we got into the mental health part, you were talking about these tests and stuff, because like I said, I've been in the hospital for this stomach issue, which is really, really painful. Lots of vomiting. I mean, we were laughing before you came on today because it's a perfect guest for today, because I literally threw up in my car driving home from dropping my kid off from school, holding a bag of vomit. I know that's gross. I'm sorry, everybody, but that was my truth today. But just knowing how many times I've been there and how many of these, Western medical tests they've given me without one answer. And that's why so I found out the name that I was thinking about, because you were talking about the vagus nerve and stuff like that, the enteric nervous system.
Nervous system, yeah.
And it was just so fascinating to me, but it's like we still don't have a solution, obviously, because I'm still, unfortunately, having some symptoms. I want to know what these tests are. I want to know, like, the tests that they're not doing. And the solutions that they're not coming at me with. It's like they like give me a bunch of pain medicine and Pepsid and go, "You're good now. We don't know what's wrong with you. Go on your way." And that's very frustrating for a patient to not have an answer after 4 years.
Absolutely. I'm so sorry you're going through that. And it is, look, I mean, conventional medicine, I want to give grace to the system, because it's not like an indictment on an individual doctor. It's the system. It's the system.
Oh no, I wasn't crapping on my hospital. I love my hospital and everybody there.
God
but
bless.
It's like they're all just going pulling their hair out. Like we just don't know.
It's exactly that was my point. Is of course it's failing you. Of course, people fall through the cracks of that. But it's like they're trained to diagnose the disease and match it with a medication. So you have the pain meds. They're doing their job. It's like expecting a mechanic for gardening advice. Like if you're having symptoms and all the labs come back quote unquote normal, there's a few things that could be happening. One is that they aren't running the right appropriate labs, and number two, maybe they aren't even interpreting the labs appropriately, because the lab's reference range is based on a statistical bell curve average of people who go to labs. People that go to labs are people that are struggling and trying to overcome stuff. So in functional medicine, we're looking at a tighter interval within that larger reference range. Where does the body functioning the best? Where it's optimal, not average? And so both are important. And I would suspect it's probably a bit of both. But I mean, hey, after we're done recording, let's run labs, let's look at this stuff, because these are the things that they're superfluous from a conventional medicine standpoint. If you see levels of glyphosate or a mold toxin or underlying gut problems, there's no pharmaceutical drugs for those things in the conventional medicine model. So if the end result's still going to be the pain pill, it's extraneous to their model of care. But from a functional medicine standpoint, we're looking at the research and saying, yeah, herbicides and pesticides, microplastics, forever chemicals are triggering autoimmune problems. So let's run the best labs we can today to look and see, is this a piece of the puzzle? Underlying gut problems, there's not a medication for bacterial imbalances or leaky gut syndrome. And if there were pharmaceuticals for any one of those things, they would be running those labs on everybody. Yeah, so what did they give you? What is this?
Like next to my bed is my antacid.
Antacid, okay.
My stomach nausea medicine, my other medicines, and I just hope and pray that they work. You know what I mean? And obviously it's not 100%. So that's all.
Yeah, no, and they're all helping symptoms out, but people don't have these issues, whether it's the enteric nervous system or gut, other digestive problems. They don't have those problems because of an antacid deficiency. So my question is, why do we use the antacid in the short term. It's a lifesaver to alleviate symptoms. But the long-term goal is, why do I have this problem in the first place? So having that both and approach even there. But yes, let's run labs and see what's going on. And it's just a different paradigm that I'm coming from.
I've been in many different types of functional medicine doctors' offices and naturopath doctors' offices. And listen, I take full responsibility of being somebody that's maybe not followed through completely with the plan they've given me, or felt overwhelmed by the plan that they've given me, which I know a lot of other people can feel, right? So let's say I was your patient, which I'd love to be one day. let's say I was your patient and we ran the labs, we have the information, we're also taking into consideration all of the emotional aspects to my history, my past, my current life, all the traumas, all the things. And would you advise to sort of begin in one area or the other, start slow? Because there's a lot of pitfalls, right? Like I think I've fallen off the wagon for a lot of different reasons. One being like I was expecting immediate results and I wasn't getting them. I would get frustrated because I'm like, oh, I'm already living with this disease and now have to limit myself in all these unfair ways. There's sort of a rebellion against it.
Yeah.
I think after many trials and tribulations, I've like finally found myself in this place of giving myself grace, having stuck with a few things and seeing some significant difference, and a better relationship with my body, again, is not feeling like it's attacking me and against me, but trying to talk to me and like, how do I work with this body? Where do we begin? So if I was sitting in your office across from you and I'm telling you all of this, like, what do you feel like would be the most beneficial approach to, trying to live better and feel better?
That's a great point, only because consistency is key, right? So I could look at someone's health history, run labs, and I could have in my mind what I think would be a plan A. Like this would be like what I've seen the best success with and the things that I think would move the needle the fastest. But if that person has overwhelm or they're stressing about it or they can't stay consistent with it, it's not going to be any good.
Right.
So pragmatically, that's part of the art of sort of the duality of the art and science of what we do. The art is like, okay, plan B actually ends up being more effective if plan B is what you can stay consistent with. So it's getting to know somebody and where they're at. And there's already a lot of overwhelm when somebody is not feeling their best and having to be their own doctor and having to go from doctor to doctor. That's a lot. So you have to meet somebody where they're at and then be there for them. And we can even pivot in real time of like, okay, no, we're sabotaging here, or this is not realistic for their lifestyle or their schedule. So we can make concessions pragmatically where we need to, because that will allow us some wins versus saying, I'm just going to give up and it's all or nothing. Mm-hmm. That creates that sort of paralysis of analysis and that sort of hyper perfection that a lot of people with autoimmunity have that predisposition anyways. That's sort of type A stress, like whatever. It's what makes you guys great, but it also
it's kind of like the lesson in this, right? Yeah.
Yeah, exactly.
Why is that? Why are most of us perfectionists, people pleasers, all of those things? It's so wild.
I think it's a mixture of nature and nurture, and I think it is just women. And look, I mean, women have it culturally too, and autoimmunity exponentially impacts women more than men. So I think it's a combination of nature and nurture. But yes, I think sometimes the best medicine is self-compassion, grace, lightness, because then when you get the why right, and it's not a list of do's and don'ts of like, no, you can't have it. And it's sort of this toxic dieting culture that can bleed into, that's not why you're doing this. You're doing this to improve your health.
Right.
But when you realize that lesson of like, no, it's not this dogmatic diet culture. This is how can I do things that I love that also love me back, and start healing your relationship with food, healing your relationship with your body. That's some inner work that people don't get overnight. But that sort of healing process of the relationship with their body and food is part of it all. Because if you don't learn that lesson, it'll be such a source of dread that's stressing about healthy things isn't good for your health, or it'll be just unsustainable and you'll give up. So I don't know if that answered your question, but it's like getting the head and the heart right. Like what you feed your body matters, but what you feed your head and your heart actually matters most. Because when you start getting that right, doesn't mean it's perfect, but you start realizing that and having that paradigm shift, then the food, the biohacks, the therapies, the peptides, the whatever you're doing is coming from a place of grace and not of sort of frenetic diet culture mentality. So it depends on where the person's at, but we would want to look at those different buckets of looking at food, looking at natural medicines, if you want to call it that, looking at peptides, looking at somatic mind-body practices, and then maybe picking one or two of each of those areas that we can stay consistent with.
Yeah. What are some of the peptides that you have found have been helpful for some of your patients?
I would say across the board, some foundational peptides would be BPC 157.
Mm-hmm.
It's just like so good for the patient base that we see. And
Do you take it
good.
regularly, like every
A
day,
cycle.
or there's a cycle, right?
Yeah. Every day for about a month. And then you can cycle on and off of it. It depends on where you're at with your goal. So after a month, if we see, okay, no, it's good, then let's try to cycle on and off of it or take some breaks off of these peptides. I don't think that most people should be on them indefinitely,
right.
consistently. But it's being monitored. It's being used appropriately. So a lot of these peptides are done subcutaneous, like through a simple little insulin injection.
Yeah, I just started BPC.
Yeah. Oh, cool.
Yeah.
Yeah, it's a great way to lower inflammation for people that are wondering. It's an immunomodulator. It balances inflammation or calms inflammation, helps repair mechanisms too. KPV is another. It's like a tripeptide you can combine with BPC. TB is another one. The copper peptides are a great repair tool as well. So those are some common ones from an inflammatory standpoint.
Yeah. So let's say for some people, like, money's an issue, right? They don't have access to certain things. What are simple things that they can do in their everyday where they can feel empowered, that they are making a better choice, that they are lowering their inflammation, that they're doing good things for their body without having to spend money? Yeah.
So for people to just keep in mind that this, like, there's those physical and mental, emotional, spiritual drivers of inflammation. If inflammation is the check engine light, if the symptoms are the check engine light, what's underneath that proverbial hood that's causing the check engine light to be on? So we mentioned environmental toxins, we mentioned these type of things, we mentioned the stress and trauma piece, but the common thread for most people is, for, like, no matter who you are, it's going to be a piece of the puzzle. It's the foods that we eat. I mean, every food we eat either feeds inflammation or fights it. And then for somebody that has the genetic variants that impact autoimmunity, they're going to have potentially, most of them, have more, and I say most of them, like, I have a family history of autoimmunity. Like, I'm part of the gang as well. So where I'm going to have different sensitivities than maybe that someone that doesn't have those gene variants that regulates inflammation, they may not have it. So this is subject to bioindividuality. But if I could say, okay, money's an issue, let's do some accessible, right out of the gate, what can you do? Look at every food we eat is an opportunity to feed inflammation or fight it. There's no neutral food. There's no, like, I'm doing nothing, like Switzerland meal for your biochemistry. So what I would call the inflammatory core four, and if you want to look at the nuance and context of each of these, we can, but it would be the four food ingredients that are most likely to drive inflammation levels up. So one, and this is in no particular order, so people can, don't come at me by this, but gluten-containing grains would be on the list. So that's wheat, rye, barley, spelt. Oats can be cross-contaminated. Now, each one of these is going to have a better-for-you version of it, and, like, what's the nuance and context of it. But I think it's a combination of, we've hybridized it, we spray it with things, we overconsume it, we're not properly preparing it. So, like, an ancient grain is very different than what we're consuming today. So all of these inflammatory core four are predicated on what researchers call an ancestral mismatch, or an epigenetic genetic mismatch, or an evolutionary mismatch, as they call it. So it's our genes and our microbiome, which is where 75% of the immune system reside, hasn't changed in thousands and thousands of years. But yeah, our world has changed dramatically in a few generations. So gluten-containing grains, does that mean that you have to avoid all breads? Maybe. Some people, I know many people with MS that they can't even, like, look at bread. I'm being dramatic there, but they have, like, if slight cross-contamination, it flares them up. Some people with MS are fine. So it's bio-individual even amongst the diagnosis. So gluten. Next would be industrial seed oils, which is a little bit more controversial, but things like canola oil, vegetable oil, soybean oil, I think it's the overconsumption of these processed oils in ultra-processed foods. They're high in omega-6. They're pro-inflammatory. There's nuance to this. There's better-for-you versions of this. I just would decrease the amount of omega-6 people are consuming in these oils and the packaged processed foods that these oils are in as ingredients, and have more omega-3s, long-chain omega-3 fatty acids, which help to lower inflammation. The ratio of these polyunsaturated fatty acids, these omega fats, matter. Third would be added sugar, but even the nicer sounding euphemisms for sugar, like be mindful, not obsessive, of the amount of grams of added sugar not in their whole food form, in processed foods, adding sugar to things. And then fourth would be conventional dairy. I think that the dairy in its whole food form can be fine, but we've done a lot. So we've done a lot to crossbreed cows, and we homogenize it and pasteurize it and feed the cows grain, not grass. And there's lots of things. So back to this ancestral mismatch, this evolutionary mismatch. So if human beings decrease those inflammatory core 4, and if I get out of +1, it would be alcohol. If we did this as a society, no matter where you're at on this inflammation spectrum, most humans would do dramatically better if they just did that. Now, obviously, health is more complex than just food. We had to get into the weeds many times, but this is a good starting point.
I was going to just say, because it brought up I was at my oncologist. This was a few years ago, and there was such an uptick of young women getting breast cancer in their 20s. And, prior to that, as we all know, you didn't even start getting mammograms until you're like well into your 40s. And I had cancer at 36. And I said to her, what is it? Be honest with me. What is going on? Why are we seeing this? And I said, is it the food? And she said, yes. And I think that I want you to talk about that because, those are the basic things that we do know, that those things can be quite poisonous to your body, the things that you mentioned. But what about the poisons that they're putting in our foods? Like the fact that that's changed over the last few decades. And now, these young women are eating foods that have things in them that are bad. Even, even in asparagus, you know what I mean? It's like, can you talk about that? Or
Totally. And then because I mentioned those inflammatory core 4, and then people will say to me, but my grandma, great-grandma drank every day. She had bread every day. She lived till she was 100. We don't live in grandma's world anymore. Mm-hmm. I mean, our kids are exposed to things so much more than we were. So back to that mismatch, like the analogy that I use here is like, everyone has their own bio-individual bucket. Some people have big buckets, some people have smaller buckets. That's your genetic tolerance for stressors. So people with autoimmune in their family, people that have autoimmune conditions, we tend to have more methylation gene variants, HLA gene variants, detox gene variants. That's your body's ability to handle stressors. We have typically smaller buckets. So the foods we eat, chronic stress, trauma, environmental toxins, our bucket's going to hit a tipping point. Our bucket's going to overflow with symptoms sooner than if somebody had a big bucket. God bless the big bucket people, but it's like we don't have big buckets. We can't change our bucket size, but we can change what we put in it. So the environmental toxin piece is a big one of what could be filling up, contributing to that bucket overflow. And I see food sensitivities you wouldn't believe. Food sensitivities to the healthiest food, it's flaring someone up. So this old sort of analogy, or this old sort of cliche to just don't eat junk food, don't eat fast food, that's it. No, that does not work for most people. Like salads are causing digestive problems. I mean, it's stressing an already stressed out immune system. It doesn't mean salads or these foods are bad. It's just the microbiome, all the trillions of bacteria in our gut are really dysregulated, and the immune system's dysregulated, and we're part of nature. I mean, you look at what's happening from a climate change environmental standpoint, as above, so below. I mean, there's climate change going on environmentally. There's physiological climate change in the form of inflammation, a dysregulated climate in a human body. And environmental toxins are impacting the soil microbiome and our planet, and they're impacting our gut microbiome. So it's inextricably linked. But the problem is, and the sort of the through line is, we can't just live in this bubble and avoid and stress about this stuff. We have to do the best we can and give the rest to God. Get organic whenever you can. Wash your fruits and vegetables, because the body is amazingly resilient. So you don't have to be perfect, but you should be informed and empowered, because then you can start voting with your dollar and getting better for you options out there.
Absolutely. Well, I also just want to say, before I ask this question, I've had SIBO for a long time, and It's that I used to treat it where I would like take the 2-week or 3-week antibiotic and then it would be gone for kind of a year or two and then sort of come back. And it's like, sometimes it's like I'll drink a glass of water and then all of a sudden I look like I'm, 5-6 months pregnant. The only thing that helped me was the Chroma Cleanse.
Oh, okay. Wow. Small world.
I know. And it's something now that I revisit like every couple of months, and it's shockingly easy. I'm like fulfilled complete. And I find that when I come off of it, I'm making better choices. Like my body's not craving the things that it used to, and I'm not falling into the same pitfalls. And it's been incredibly helpful. So I just wanted
Amazing
to tell you that.
Yeah, we developed that with Lisa, and she's amazing. It's for people that don't know, it's a lot of it's bone broth based, but just easy to digest, gut friendly foods, and she made it super convenient. And I help out over there as the wellness director. So yeah, it makes it convenient, right? You just add water and it's already done.
Very convenient. In the biohacking world, right, there's like so many new, fun, cool tools and things that are out there. I feel like you have access or have had access to many of them, if not all of them.
Yeah.
Are there a select few that you were like, these are game changers? Like these are wonderful things if you can have access to them that can make a real difference in your health?
Yeah. Well, look, a lot of this stuff is, maybe just to demystify this, I think some of the best biohacks are free or low cost. Like I think getting out in nature is so undervalued because we want the flashy, expensive like gadget, and those are cool too. But I feel like sometimes the gadgets are the next level. Like you have to have a foundation of things that are supportive of the parasympathetic. And I live in the woods, but like if you live in an urban area, like find the green space, find the park. Even there's studies that show even pictures of nature can have a calming effect.
Wow.
Bring houseplants into your house. I mean, it's as much as you can. There's research out of Japan and South Korea looking at Shinrin-yoku, the Japanese term for forest bathing. It's using nature as a medicine and meditation. But nature has these phytosanides, these basically essential oil compounds when you're in nature that help to basically crosstalk, communicate with our own immune system, and regulates the gut microbiome. So taking in as a meditative practice, whether it's grounding and you're sitting by one, like at my telehealth clinic's kind of in an urban area. So I'd have this one sad, lonely tree on this tiny little patch of grass that I sit by, put my feet in the grass and do some grounding there. And that's a great way you call it biohack. It's like nature. It's actually the original biohack is nature, right? A lot of biohacks are devices that help us, but it's really mimicking nature. So some of my favorite ones are infrared sauna. I love infrared sauna. I mean, if people have access to it, it could be great. I have a sunlighting one, but even if you can't afford one, like a sauna blanket can be nice, where it's just making sweating and heat a part of your life. Infrared's a great tool. Cold plunging should be done judiciously. As long as
I was going to ask you about that because, heat is, for those with us with MS, is usually rough.
Trigger.
Like, for me, like I'm like, my body just kind of shuts down because I don't have the ability to sweat.
I like how you say rough.
Yeah.
There's a one choice of word for it.
It's kryptonite, Jamie.
It's kryptonite, correct.
Kryptonite.
Okay, there
so
you go.
I
Sorry.
found myself doing a lot of cold plunging, and I was feeling good, like fatigue-wise, everything-wise, but then I was hearing all of these, things that were like, you shouldn't be cold plunging, or you have to be selective when you cold plunge, especially for a woman. So could you tell me a little bit about that?
Yeah. So, and this is so subject to the bio-individuality too.
Sure.
So someone with MS, I would want to build up heat tolerance over months, because you want to sweat.
So that's something you could do.
Oh, yeah, absolutely.
You could build up oh my God, I live in Texas. That would be a dream. I need to build a heat tolerance.
Yeah, right. I mean, your infrared sauna is outside in summertime in Texas.
Right.
So you look, and some people, I'm not saying push yourself and be aggressive. I'm saying it may take a long time, but work on nervous system regulation so the and immune system regulation so the heat tolerance can build over time. And you may not ever be super high heat. I'm not saying that, but just appropriate moderately so, building up heat tolerance, because we want to build resilience is the goal here.
Yeah.
And for someone with MS, heat intolerance is a lack of resilience. So we want to be building that low and slow over time. But cold, while it could be the same for somebody else, it could flare somebody's like Raynaud's up, but it's great for someone with MS typically. So we want to look at time and temperature for both cold and heat. And I love contrast therapy for that too, where it's like a little bit of heat, a little bit of cold, and sort of the vasodilation, vasoconstriction can be a great way to lower inflammation, support these pathways that we want to be supporting. But yes, I've seen cold plunging be a great medicine and then overdone. Because what are they? They're hormetic effects. They're like a good stress. But stressing, again, an already stressed out system, you don't want to overdo it. It can easily be overdone. But even if you have the water in the 60s Fahrenheit, it's still going to be cold. But it may be, if someone that's never done it, start with a couple seconds in like the high 50s, low 60s, and then over time, decrease the temperature, increase the time. And similarly, we would do that with the sauna, only, lower temperature, lower time, and then build up time or temperature. So those are some of my favorites. I love PEMF mats, which is like mimicking grounding. I love blue light blocking glasses. I don't have mine right now. I should have it. But like blue light blocking glasses can be great for people that are on screens all the time to help with their sleep-wake cycle. Those are some
Red
ones
light?
that come to
Do you
mind.
like red light?
Yeah, I have a red light therapy. I don't use it as much, but my wife loves it. So she's sitting in front of that thing all the time. Sunlighten makes a red light panel that we have. You know what else that I love for myself and for telehealth patients? It's transcutaneous vagal nerve stimulation.
What is that?
It is a devices, there's lots of devices that you can attach to your ear or your neck, and they attach to these branches of the vagus nerve, this enteric nervous system that Christina was talking about, like the aspect of that resting, digesting. So it's stimulating. And what I like about it is that it is, there's not a replacement for breath work and trauma work and these type of things, but it's something passive that you can just have on, and you could be like picking your kids up or sitting and whatever, watching a show, but it's stimulating that nerve that we want to be strengthened, because that fight or flight response is overactive in most people. We want to start calming that and activating that resting, digesting parasympathetic. So vagal nerve stimulation, it almost feels like a little bit buzzing, like an E-stim almost, but on these branches, you're attaching it to your ear, your neck. There's different brands out there, but it's one of my favorite for myself and for our telehealth patients.
Yeah.
I'm
gonna
slow.
look into that.
Sorry.
No, I was just going to say I was going to look into that.
I'm just really slow because we were talking about heat and trying to introduce it into ourselves. And I remember I had one, practitioner tell me to put my feet in an ice bath every day. And, I don't know if anything did. But then I had another practitioner have me put my feet in the hottest water that you could possibly have with Epsom salts for like 15 minutes. And I couldn't believe what was happening. Like, I don't know why I haven't done it for like a month. What's wrong with me, man?
Well, now you
it's a
I was just
reminder.
wondering, like, your thoughts on that, because it really did feel like it was pulling all this stuff out of me and really changing how I walk and how my feet felt. Anyway.
Yeah, no, I think
you guys were talking about that like 20 minutes ago, but
no,
just
that's a great way to start off low and slow, because you're not immersing your whole body. You're just doing your feet, so your core temperature can still stay room temperature. But we have patients work on Epsom salt baths, so if they don't have access to a sauna or sauna blanket, doing an Epsom salt bath is a great way. And even more conservatively would just be your feet, because you're not heating your whole body up. So then maybe after a while with the Epsom salt foot bath, then you try like a lukewarm Epsom salt bath, and then just build up time and temperature over time. It can be a great tool. I love that you did that, and you could stay consistent with it.
Support for Messy comes from Mudwater. So I spent so many years just like caffeinated, completely caffeinated. And at some point in my life, I started having stomach issues, and also noticed that I would get so jittery and then crash. And I was so struggling with like brain fog and feeling groggy in the mornings, but I needed something. And especially that taste, that smell, that beautiful smell in the morning. And I found Mudwater. Mudwater's new low-calf coffee has been such a relief. It's made with organic Arabica coffee, Swiss water decaf, L-theanine, and functional mushrooms like lion's mane, which is so good for you, and cordyceps. So you still get that rich, full-bodied taste coffee lovers crave, but with only 45 milligrams of caffeine. Enough to feel awake and dialed in without the jitters, the crash, or emotional roller coaster. None of us need that. And if you want something even gentler, the original blend is still there for you. The coffee alternative made with cacao, chai, turmeric, oh, so good. And again, functional mushrooms. It's warm, grounding, and perfect for days when you want energy without the buzz. But for real coffee lovers who just can't handle that heavy caffeine anymore, this new blend hits the sweet spot. Real coffee taste, calmer energy, no spiraling thoughts. So, listeners, are you ready to make the switch to cleaner energy? Head to mudwater.com and grab your starter kit today. Right now, our listeners get an exclusive deal up to 43% off your entire order, plus free shipping and a free, my favorite thing, rechargeable frother when you use code MESSY. That's right. Up to 43% off with code MESSY at mudwtr.com. After your purchase, they'll ask how you found them. Please show your support and let them know we sent you.
It feels like everywhere you turn right now, it's new year, new me. But growth isn't a glow-up trend, okay? It's a practice. With growth therapy, it will help you do the real work with licensed therapists who meet you where you are, not where anyone else says you should be. And before you give me the therapy is too expensive and ending our conversation, what if it doesn't have to be? Because with growth therapy, care is designed to be affordable, insurance-friendly, and easy to understand. No subscriptions, just support that fits your life and your budget. Therapy has been such a game changer for me, and it's taken a long time. It's taken a long time for me to find tools and practices and new ways of thinking that become so consistent that I see real change in my life. So whether this is your first time in therapy or your 50th, like me, Grow makes it easier to find a therapist who fits you, not the other way around. They connect you with thousands of independent licensed therapists across the U.S., offering both virtual and in-person sessions on nights and even weekends. You can search by what matters, like insurance, specialty, identity, or availability, and get started in as little as 2 days. And if something comes up, you can cancel up to 24 hours in advance at no cost. There's no subscriptions, no long-term commitments. You just pay per session. Grow helps you find therapy on your time. Whatever challenges you're facing, Grow Therapy is here to help. Sessions average about $21 with insurance, and some pay as little as $0 depending on their plan. Visit growtherapy.com/messy today to get started. That's growtherapy.com/messy. growtherapy.com/messy. Availability and coverage vary by state and insurance plan. I love hearing you say this too, because to be quite honest, I don't know if I've sat across from many professionals in your field that have ever been like, we can build the tolerance. It's always like, nope, stay away from that. You got this, you got to stay away from that. And I think that type of information is empowering and inspiring, and just another seed to plant that there is healing possible. Because I think for so long, I just, I struggled with the acceptance that this is, what I have and what I have to live with. And it kind of has to be this way. And you feel like you can never get ahead of it and you're sort of a victim to it. And so the idea that and the ability to tell yourself and your body, you can heal, you can feel better. I mean, to me, feels like was the missing puzzle piece, because I was a good little soldier, but everything, like you were saying, felt stressful and it felt aggressive. And it was almost like the worse my MS got, the harder I had to go. And it's almost been more of just like a soft, and gentle approach, which feels like counterproductive to sort of what's going on with my body. But I've felt more change in me, in all my bodies, by just being more gentle with myself.
100%. Because if gentle is more sustainable and consistent, consistency is key. Right. Again, that's mind-body component too, the stress around these things. Like pushing through rarely is the name of the game when you're talking about healing from any issue. Normally it's, okay, yes, we need to progress. I'm not saying we should progress, but what's that perfect, like that line, back to the art of it, because there's not like a rule book for this, but the art of it is, where do you feel like you're improving without aggravating things? And that line, as you build resilience and regulation in the body, then that line's going to move. And what flared you up before isn't going to flare you up anymore. So
Right.
That's what we need to work on. And if you're building resilience over time, and for anybody with any type of inflammatory problem, your flare is going to look different than the next person's flare. But I want there to be more wiggle room where you don't pay for things if you deviate from the things you think, that you have this set of safe things. I want the list of things that love you back to grow and the things that don't love you back to shrink. Of course, that takes time.
Yeah.
But yeah, it's that would be a goal for me, for you. So I would be like, okay, we can go outside in Texas in the summertime for maybe never at all right now, and then we can spend a couple of hours without having a problem. And you have to build that over time.
I was, just recently, I got into probably the worst flare I've had, I think, ever in my life. And it was around the time that a bunch of really bad things were happening in my life. And that just feels like I was inflamed by other people's crap. I know that sounds really weird, but like it was like all like almost at the same time that stuff was happening. All of a sudden my legs went down. I couldn't speak. I couldn't think. I was sound asleep all the time. So that's the kind of, when we talk flare for MS, that's usually what our symptoms are really presenting as. But like, can you talk about that of like, how do we manage the outside noise is what I'm trying to say, because there's a different, how do I regulate that? Like they're doing it and they're being very, very bad people, but it's, how do I not take that on? And then I'm the one who's experiencing all of the horrible symptoms and losing time. So that's something that I struggle with greatly.
Well, yeah, it's a lot more nebulous and nonlinear and complex, because it's more straightforward and prescriptive for me to say, eat these foods, don't have those foods, have those peptides, do these therapies. It's a lot more, okay, how do you unpack things like stress and trauma or relationships, life itself? But we have to talk about it. You're absolutely right. I mean, I have people that, we talk about like letting no be your multivitamin, and like using it often and like being okay, and talk about the FOMO culture that we have, the fear of missing out, and finding JOMO, the joy of missing out. And these are practices that, they're nice little sound bites, but it's like, these are deep, hard practices to like learn how to renegotiate and have healthy boundaries with the people around you. And Eckhart Tolle, the author and amazing person, talks about if in any situation that's giving you dysregulation, that's causing you stress in some way, that could be impacting your physical health. And he says, can you change, leave, or accept it? And those are three things that I think are really powerful and that I have our telehealth patients go through. It's like, okay, maybe it's a relationship or someone at work. Can I change the situation at work? Maybe I can like have a conversation and fix it. Can I leave it? And for some people, it could be one of those two things. They can change or leave it, and they need to face it. For some people, they can't change it. They can't change their job. They can't leave their kids, or if it's their kids. They need to find radical acceptance. And that's sort of that deeper spiritual work that happens sometimes, but it's really needed, because when your immune system, nervous system is dysregulated, and a lot of people we talked about with autoimmunity have that sort of type A perfectionist personality, they also can be highly sensitive people too, and are taking in energetic things that's stressors that's impacting their own health.
Oh, I'm a sponge, man. It's like, everyone goes nuts, and I'm like, let me take all of your pain into my own body, and I got to work on that.
Yeah,
crap.
sometimes I look at it almost as like I've tried to reframe, at least with my body, and think it more of like it will show me immediately if I'm a little more stressed, or if I'm sensitive even to a food or whatever. It's like, oh, you speak to me right away. Thank you. I'm not wasting any time of not knowing if this is good or bad for me. And, I think also I really appreciate everything that you've said. And for those that are listening, I think it's like there's been a lot of talk about like the one size fits all, like if you got to do it this way if you want to get better, because this is how I did it. But I mean, if MS can show you anything of the way it sort of presents itself so differently for everyone, there is no one size fits all. It's an opportunity, right, for you to really get to know your body and get to know yourself and get to know your triggers and your inner workings and how to take better care of yourself. And I think that's been a gift in this experience, is it's sort of like I can't run, I can't move fast. It's forcing me to kind of be more still and be more present. And reframing that, I think, has helped me felt safer in my body and allowed me to sort of figure out what the path is for me,
Yeah. You have to meet your body where it's at.
Right.
You have to.
Yeah, I also want to share one thing that was like really special and amazing, and I've tried to learn from all the time. My son had a very rare, crazy encephalitis reaction. It was called ADEM a year and a half ago, and it was a wild ride. And he was, very ill. He almost died. He went into psychosis, this and that. But when we were in the rehab center of the hospital, and I was with the head pediatrician there, and we felt like we were on a healing trajectory. And I had said to him, I said, this must be so hard for you to be in this section, in this work, in this hospital, and see children who are ill. And he said, yes, it's incredibly difficult. However, I love it so much because when you tell a child you can get better, the healing is so fast and so miraculous because they don't doubt that they deserve to heal. And hearing that and experiencing that and seeing it before my eyes, like I just want to share with you and everyone listening, because it just was so powerful. Like, we deserve to feel better. This isn't a curse. This isn't something we did wrong that we deserve. Like we deserve to feel better. And people like you are helping us do that.
Thank you. Thank you so much. That's beautiful. And there's a book. I haven't read it myself, but some of friends and colleagues of mine are in the book. But my telehealth clinical team recommend it all the time, and it's on that subject you just said. And it's specifically people that have MS, have autoimmunity. It's called The Other Side of Impossible. Have you read it before?
No, I'm going to order it right now.
Yeah, but it's apparently all these stories of like, you can heal, of like what people have done, of just inspiration to know, look, there is a light at the other side, and you aren't alone. And it's that sort of power of belief. I mean, placebo gets a bad rap, but the science of placebo is so powerful, right? It's like the mind over matter of like what your body's capable of. And as there's placebo, there's nocebo effect of like what negative thoughts and ruminating thoughts and like I'm never going to heal, or identification with your symptoms. That creates an outcome too. So these things that we feed our head and heart impact our biochemistry just as much as a food does. So people need to realize the power of thought and the power of keep the company that you keep. These things are really healing or can be detrimental.
Right. And to what you were saying before, when it comes to a diagnosis, you can't change it, or hopefully we can change it, but like we have to accept it. I think it's the first part and the hardest step, at least for me. I mean, it took me 20 years. Yeah.
Well, I think you said something really poignant. Both of you did, of like this sort of mourning of like, okay, I'm going to rebel against this because I already have the symptoms. I don't want to be more restrictive. That's normal. That's a part of the process, is that mourning of like, because you haven't accepted yet, and you need to go through these mourning to then say, I'm in radical acceptance. Now what can I do to move my health in the positive direction?
Yeah. But there is a grieving process. And I appreciate you saying that is part of it, and it's okay.
Yeah,
right?
Absolutely. It's needed. It's needed because that means you're facing it head on. And you almost need to purge that and process that grieving sort of journey to then say, all right, you're going to be the phoenix that's going to rise from the ashes.
I love that. Well, Dr. Cole, please tell us how everyone can find you and follow you if they don't already. I'm so appreciative of you being here, truly.
Thanks, guys. I appreciate it. It's great to talk with you both. Everything's at drwillcole.com, drwillcole.com. But my books, the telehealth center, the labs, all this stuff. I have a podcast. It's called The Art of Being Well. I would love for you guys to come on whenever you want to.
Would love it.
Standing invitation. Let me know.
Thank you.
But it's all about these things, this autoimmunity and the science and art of healing. And yeah, so that's everything's at drwillcole.com.
Amazing.
Well, keep doing the good work and making people believe that they can heal, because it's doing something. Including with us. So yes. And we just close out every episode with a quote. I pick it randomly from a little deck of cards. So I'll read today's. The ability to simplify means to eliminate the unnecessary so that the necessary may speak.
That's a good one for today.
It is a good one for today.
We always have, Dr. Cole, they always land right on brand, as the kids say these days. These cards, they really follow what we're doing. So thank you so much. That was really informative, and I think you're going to help a lot of people.
Thanks so much.
We're excited to send them to you as well.
Thank you.
This show is executive produced by Christina Applegate, Jamie-Lynn Sigler, and Allison Bresnick. Our audio engineer is Josh Windisch.
And if you want to show us some love, don't forget to leave the show a rating or review. Hi, it's Jamie. Thanks for listening. I just want to let you know I am a paid spokesperson for Novartis, but this podcast is independent from my collaboration with Novartis.